An I-team investigation into the state's COVID vaccine rollout.
Governor Baker made the decision to use mass vaccination sites to distribute the shot, hiring private companies to run those large-scale locations. The contracts have cost the state millions. Our chief investigator, Cheryl Fiandaca, looks at whether it was worth it.
Congratulations.
All right, thank you.
Easy and convenient. That's what people said about getting the COVID-19 vaccine at a pharmacy or medical facility.
It was really great to have it done more locally.
They just put the needle in me and then that was it.
But early on, that wasn't the case for folks trying to get the shot at one of the state's mass vaccination sites.
It just died on me.
Problems scheduling an appointment on the website and long lines in the cold at big sporting venues kept a lot of people away.
You can have your ID out.
The I-team found out of the approximately 6 million vaccine doses administered, weekly data shows only about 20% got the shot at one of the mass vax sites. 80% preferring to get the vaccine at hospitals, clinics, health departments, and pharmacies.
It's kind of shocking. The numbers that you've dug up are showing that people want to go to their local pharmacy or to a hospital, a medical office. That is the most effective and preferred way. It's also less expensive for the taxpayers ultimately paying for this.
The mass vax site's a concern of the Legislative COVID-19 Oversight Committee.
People get frustrated, and I understand why.
The Baker administration gave no-bid contracts to 3 private companies to run the sites. The I-team reviewed the contracts with CIC Health, Curative, and LabCorp, and estimate they have billed the state at least $24 million. But that number does not include pass-through expenses and is likely much higher. The state has refused to tell us how much money it has paid.
The state, has not been completely transparent. All of this money that these private contracts are going into for these mass vaccination sites, there's a limited role for a mass vaccination site. Every dollar matters right now because the cost of this pandemic is going to be experienced by all of us for years.
State officials have to really weigh when they see this report is to look at the numbers that you brought out. It might be the time to de-emphasize the mass vax sites and start to take some of those vaccines and give them to the pharmacies and to the medical offices. That's the bottom line.
The Department of Public Health did not respond to our numerous requests for information or comment. We did reach out to the 3 companies running the mass vax sites. None would provide the exact amount of revenue it received from the state. Cheryl Fiandaca, WBZ News.